high sitting position. High sitting inside. Patient position is high sitting. Therapist position is side to the patient. Okay. So which grade we used to start?
3.
Yes, grade 3. What is grade 3? What is grade 3? Yes. Grade 3 tell.
Full range of motion.
Very good. Others don't tell.
Maximum resistance.
Hey. Where resistance comes?
Against the bucket.
Huh?
Against the bucket.
Full range of motion against gravity. This is correct. You are telling maximum resistance, minimal resistance. You are in this classroom or somewhere else. Okay, Shabab, grade 3. Against gravity, the movement full against gravity, full range of movement without resistance. Okay. Right. So I am going to do right side. Right. The movement is like this. The knee will go up. This is the movement. Okay. For hip flexion. Is occurring hip flexion or not?
Yes.
Is hip flexion is occurring or not? See here. Lift up. Yes or no? Yes. Yes. This is grade 3. Now I am going to do for him. Okay. Right. So now I am going to test your muscle, okay, which is here. What you have to do is, you have to lift your knee upward direction, upward movement, okay. Sit straight, okay, yes, lift it up, very good, right, down, okay. This is grade 3, because full range of motion. How much hip flexion full range is, how much full range? Yes, what is the range? Hip flexion range of motion, ROM. 180 decreased. No, wrong. Huh? Wait. Yes, sir. Very good. 120. When 120 when? Sad. 120 is when? Hip flexion is 120 degree. When 120 degree, hip flexion will occur. Hip flexion can be two. One is 120 degree, another one is 90 degree. When you will get to 120 degree, and when will you get 90 degree? When you will get 90 degree? Okay, so when will you get 120 degree? Very good. Right, very good. So now he is sitting with knee flexed or knee extended?
Flexion.
Yes. So knee flexed. So supposed to be 120 or 90?
100.
Yes. That's why from here 90 degree flexion now. Already he is sitting 90 degree flexion. From there going more. 120 degree. So when there is 90 degree? Very good. When knee is extended, hey. I told you 1, 2, 3, 4 should not sit together. If they sit together, I told already, I will make them late. I told you, no? Yes or no? Hey, Khalid, you are leader. You tell me. I told or not? Sitting together and laughing each other. I will make this. You 4 will take today. Yeah, you also laughing with them.
صور
But you two people.
والله ما يهم.
Sit somewhere else. Oh, that's it. No, go there.
هذا يسرع يا ولد.
سليم ابو حميد ما سليم يا احمد بتجي مود
Okay. Yes, please.
Why you don't make supine?
Okay.
Supine position.
Okay.
Why you don't?
Yes. When I make supine position, come supine position. When I make supine position, and if I do hip flexion, okay, supine and hip flexion, leave it, right? So that time also hip flexion only. But why not then? Because when we do supine position, there is a muscle is called rectus femoris. Rectus femoris, you know?
Yes.
Two joint muscle, which is starting from ASIS, inserting to the patella, crossing the hip joint and crossing the knee joint. Two joint muscle, that will act, that will work. So rectus femoris main action is knee extension. Rectus femoris main action is?
Knees.
Yes, it is one of the quadriceps muscle or not?
Yes.
So already we studied quadriceps muscle now. So why we have to study again? Correct? So now muscle is, or movement is studying is hip flexion. Main muscle is iliopsoas. That's why we are not keeping subject in supine position. Good question, Sabab. I want to like this question. Nobody asking. Please clap for him, everybody. Yes. Please ask some questions like this. You will get knowledge. You will get more points. Please ask me. Okay? Yeah, come again, sit. So, I told you two hip flexion degrees. One is 90 degree, another one is 120 degree. 120 degree, why? Because of knee flexed position. 90 degree, why? Because knee extended position. Okay, when you keep knee flexed position, why more? When you do knee extended position, why less? What is happening? Yes, Khalid. Sorry, yes. Sorry.
Because quadriceps flexion with
When, which knee flexed position or extended position?
flexion
Okay, knee flexed position.
with help iliopsoas.
Not helping. I am asking you, there is 90 degree and 120 degree. When you 90 degree of hip flexion is occurring when you extending the knee. Okay. 120 degree of hip flexion is produced, right? When you flex the knee. Okay, correct. Your answer is very good, correct. My question is here. Why like that? When you flex the knee,
Yes,
why
yes.
more range? When you extend the knee, why less range? 1 minute. Anybody else? Okay, wait, I'll come. Yes.
Type of joint.
Type of joint. Which type of joint?
Ball and socket.
So what? So, Bob, 1 minute. Ball and socket joint means?
Hamstring.
No.
Type of
No.
no, another
Another answer.
hamstring muscle.
So, okay. Correct. Very good. Hamstring muscle. What is happening?
Stress.
Hi.
When?
Next.
Accent ولا
No, you are this. Taking here one foot, there one foot, like this. Not telling properly. Yes.
Because when knee extension, hamstring stretch.
Yes. When you keep knee extended position, hamstring is stretched where?
Stretch.
Where?
Hip.
Knee
Yes.
and
Hip.
hip also. So when a muscle is getting stretched, then the muscle is cannot allow you to do more movement. That's why when we keep knee extended position, hamstring will not allow to do more than 90 degree of hip flexion. Correct? Same answer. When we keep knee flexed position, the knee joint hamstring is relaxed. So then when you can do hip flexion little more. Okay? That is which insufficiency? Hamstring is lengthening in both joints. This which insufficiency?
Bas.
There are only two, active or passive. Correctly you tell. One is telling active, another one telling is passive. So one is wrong, one is correct. What is active insufficiency? What is passive insufficiency? I am telling this is fourth time.
Bas.
Doctor, shorting active.
Why shorten active?
ولنجت passive.
Okay, so he is correct. If the muscle is shortening both the joint, that is active insufficiency. I told you to remember like this, right? When a muscle will shorten, muscle when is contracting. When a muscle is contracting, will you say muscle is active or muscle is sleeping? So, when a muscle is contracted or shortened in both the joint, it means active insufficiency. when your muscle is lengthened in both the joint, passive insufficiency. You remember like this.
Yes.
Active means shortening. When muscle go for shortening, contraction.
Yes.
Yes, contraction means active. Like that you remember, okay? Right. So again I come back to you. So grade 3, hip flexion, sitting like this, high sitting position, legs out of the couch, therapist standing close to the patient, right? Telling the patient to raise the knee upper direction, okay? Sitting straight, yes, please rise knee upper direction. This is grade 3. Now I am moving into grade 4. What is grade 4?
Minimal
Against gravity,
resistance.
full range of motion, minimal resistance. So I have to give resistance just above the knee joint. Just above the knee joint. Here. Okay. So my another hand should do what?
Support.
Should do with the using mobile? Then what should do?
Joint.
Yes. Touch, no touch. I have to stabilize. Where I have to stabilize? I have to stabilize the pelvis. Okay? I have to stabilize the pelvis. So again I will tell him to do the same movement. Please lift your knee joint up. Okay, wait. While you lifting, I will not allow you to lift. Okay? I resist you, but you have to overcome my resistance. Do it? Yes. Very good. Yeah. This is grade 4. Grade 5?
Maximum.
No.
Against gravity.
Against gravity, full range of motion.
Max.
Don't forget 3 words.
Okay.
Okay, so now again, no, you have to do the same movement, lifting your knee upward, but this time I will give more resistance. Okay, yes, up. Very good. So this is grade
5.
Okay,
Grade
now
2.
grade 2, elimination gravity. Side line, very good. Side line, yes. Which side he has to lie down? Very good. Because I am doing right side, then only the right will come up. Okay? Your left side line.
Left يسار.
Okay? So, again very important is, right? Patient should be side lying. Okay? So, important is knee should be flexed. Knee should be flexed. So the therapist should support, standing behind the patient. Okay, see how I am supporting the leg, you see. I am not keeping like this. Okay, why I am not keeping like this?
You can do flexion.
When I do like this, when I keep like this, there is a stress to knee joint. See, knee joint, there is a stress. Okay, but when I keep like this, see, I am supporting the knee joint. Okay, so always do like that. Okay, so like this position, I am starting position is this. Okay, yes, keep here. Right now, again you have to bring your knee front side. Okay, yes, very good. Like this. This is grade 2, elimination gravity. Then grade 1, right? Again going for grade 3 position, palpation. Palpation to be done where? In the, you know, the ilium, anterior to the ilium. You remember the muscle? Starts in ilia psoas, iliacus and psoas major. You remember psoas major? Psoas major starts where? Lumbar vertebra, L1 to L5. Iliacus starts from ilium, anterior to the ilium. So, but this psoas major, we have to palpate just above the ilium, deep muscle it is, difficult to palpate. Okay? But still, right, in the anterior to the hip bone, right, anterior to the hip bone, there you can palpate and check. But both muscles are deep muscles. One thing you should remember, we cannot palpate the deep muscles. Okay? That's what, gluteus we can palpate, but below gluteus there are so many muscles, we cannot palpate. Any example, can you tell? Below gluteus maximus, what is the another muscles? What are the other muscles? Minimus, other muscle, minimus, medius, also big muscles. Other small muscles. Huh?
Pectoralis.
No, tensor fasciator lateral. I am telling about gluteus. Gluteus magnus, such a muscle is not there. Adductor magnus. Adductor side, inside. What about pectineus? Sorry, what about this one.
Giraculus.
Huh?
Giraculus.
Obturator, internal obturator, external gemini, superior gemini, inferior gemini. All external rotators. All external rotators are behind the gluteus. So difficult to palpate. Okay. So like that, this iliopsoas is difficult to palpate, but still you can try. Just hip joint in the line with the hip joint, just deeper palpation there. Okay. So first action is hip flexion. Clear?
Yes.
Okay. Moving into hip extension. You can go down. Yes. Come. Sit down.